welcome to a special edition of Hude Hour, our Hude Special. And today we will be focusing on a very interesting topic, talking about the World Hepatitis Day. But before I go further into this, let me introduce myself. I am Amadin Owewe.
And I am Joan Eze. Welcome to Hude Special.
All right, and also here with us is Dr. Hadiza Gani. She is a senior registrar at the Departments of Gastroenterology and Hepatology units in the University of Abuja Teaching Hospital. She joins us now to talk about the special commemoration of the World Hepatitis Day. It was commemorated at the university recently, and it featured screening, public lecture, and also counseling for all those who were present. We'll take a look at the report, and then when we come back, we will be having a discussion on the road so far, on the theme, what needs to be done as we commemorate World Hepatitis Day. Don't go anywhere, we'll be right back.
Every year on July 28, the world unites to raise awareness about viral hepatitis, a disease that still claims over 1 million lives each year. This year's theme, Hepatitis, Let's Break It Down, emphasizes the urgency of turning awareness into action. At the University of Abuja Teaching Hospital, World Hepatitis Day was marked with free screening, public lecture, and private counseling sessions designed to inform, detect, and support. Dr. O.J. Ogbonaya, a gastroenterologist and hepatologist, explained how hepatitis often spreads silently through unsafe injections, unprotected sex, or from mother to child.
Most common among them being sharing of sharp objects like clipper or the metal women use to knit their hair and all that. So sharing of razor, sharp objects generally, or just people that cut nails. Also, it can be gotten from child to child. When children play together, one has wound, the other person is touching and all that.
Dr. Hadiza Gani highlighted that diagnosis is only the beginning. Without proper follow-up and consistent treatment, many patients fall through the cracks.
We also get people coming to tell us, when I was tested, I was given a drug and I was told to go. Everything was okay. It's not like that. Those with hepatitis B need to be constantly followed.
Fellow physician Dr. Ugo Ibewuchi added that early care before symptoms show can be the difference between life and loss.
The essence of this kind of exercise is to make sure that people are offered whatever treatment is available when they are still relatively healthy. You don't want them to fall ill, because most times at the point when they fall ill, it's like a land of no return. There's little or nothing that you can do, and it's very, very painful.
From prevention to vaccination, the advice was clear. Don't wait until it's too late.
Avoid risky behaviors, avoid multiple sexual partners, and please use protection and all that. Above all, get tested, get vaccinated, and get treated.
For many like Abiodun, Chisom, Onyishi, and Deborah, it was their first test. Their reasons were personal, but their message was shared. Act now.
Other people like myself should also come for screening, because it's very important to know your status, if you are negative or you are positive. So you know how to manage yourself.
Just go. I know that's positive. There's a fear, so you just have to just go to be on the safe hands.
And if by any chance, unfortunately, you are tested positive, you don't have to be afraid. Just go and meet a medical personnel to manage your case.
It's better for you to test yourself and know than to be ignorant and say, no, I don't want to do this. I don't, in case I might be scared. To know your health status, because your liver might be damaging and you might not know. You just stay at home and be like, I don't want to do the test. But the test is free. It's free of charge. You come, you test, and you know your status.
From doctors to patients, the message from UATH is united, which is hepatitis can't wait. Not for awareness, not for testing, and not for treatment.
Well, welcome back. That's an interesting one there. It was certainly a good one. After all, I was there myself. I got tested as well. And I also got counseling. Like I said before the break, we have been joined now by Dr. Hadiza. She joins us right here in the studio to shed more light on this. Welcome to the program, ma'am.
Welcome,
it's good to have
doctor.
you.
Thank you
It's good
very
to
much.
have
Thank you
you.
so much. So let's start from the theme of this year. It says, let's break it down. And it refers to a lot of the barriers faced to care. We have financial, we have medical, structural, social. Can you walk us through some of these things that prevents people from getting the care they need and how we can solve them?
Okay, so first is information. Most people don't have the right information. They don't know that something like hepatitis even exists. So people need the right information. And then aside that, for some people that know about it and have probably been previously tested, and are positive, they don't know that they should actually be followed up in the hospital. Aside that, some people have been tested and qualify for treatment. They've been placed on treatment, but for some reasons decide not to be on that treatment. So, the right information, it's very important. That's one. Another factor is accessibility to care. Some people don't even know where to seek for the right help, the right care. So, aside that, I think financial constraint is also a big factor. It's also a big barrier. Some have the information, have been tested positive, but they cannot afford the treatment. Treatment for hepatitis, for those that qualify for treatment is usually on a monthly basis. For hepatitis C, treatment could range in hundreds of thousands to even millions for a specific period of time. Now, for those that are unaware of the disease and have probably developed complications, they do not have access to the care you want them to. Most of them, you have to refer them outside this country. And some people cannot even afford that kind of treatment. So these are just some of the barriers that are preventing us from eliminating hepatitis and its complications.
So are there any social ones? One of the issues there.
Yeah, some people don't even want to be told that. They don't even want to test it. Fear of the unknown, because some people might actually stigmatize them. So there's that social stigma attached.
All right, so let's go to what the WHO Director General said, and he made a statement that every second people die, of this severe particular disease.
Yes.
And he also said something very, very striking, that we have the tools. Now, coming from the report, we see that a particular process was conducted, a screening was conducted. So why is it so important for the screening that has been done to be conducted, and what's the whole issue, or what's the idea around it?
Okay, so early detection.
Okay.
Early detection, because we want to detect those viruses that are responsible for causing chronic disease, that's long-term disease, and eventually liver cancer, that's hepatitis B and C. We want to detect them early. The fact is, if you detect them early, you can actually do something, either monitoring or treatment. Hepatitis C is curable, so it's actually possible to achieve cure. Now, if you don't pick it early, what you'll be dealing with later will be more of complications. That's when people the virus begin to have, things like body swelling, they start vomiting blood, stooling blood, So you're dealing with complications. And then when liver cancer sets in, you're also dealing with complications. So we want to get them early when it's treatable, rather than catching them towards the tail end when you can actually do little or nothing.
Indeed, indeed. Actually, another doctor, an hepatologist, a gastroenterologist I interviewed us made mention one time that liver transplants don't happen currently in the country, according to him or thereabouts. So we can understand some of these gaps. But I wanted to address some specific ones, perhaps on the solutions aspect now. When it comes to stigma, when someone is afraid that my colleague has hepatitis, now he has to be sacked or I have to leave the job. What can we say to that to perhaps dispel any issues or how these things should be? And then also when it comes to financial aspects, are there any programs or any options for people, perhaps when they get screened, that they can look forward to that can help them? And then a final one is on the issue of where can people actually go for care, if you want to direct them.
Okay, so talking about stigma, we've seen people coming down to us, okay, I am going to a specific country and because I'm hepatitis B positive, I've been asked to come for treatment. Some will tell you I'm not going to be issued visa because those countries actually don't want people that have hepatitis to reside there. That's one, you see that stigma. And then sometimes food companies kind of include hepatitis testing as part of healthcare, their screening, pre-employment or maybe ongoing employment screening. So it's a stigma. But when you look at hepatitis, it's really transmitted through B and C, which they usually test for. It can actually be transmitted through blood product or contact with body fluid, not fecal, oral transmission like hepatitis A and E. So sometimes you look at the job and then not kind of, will I say, deprive them of that opportunity because they have certain types of hepatitis. So that can only happen if they seek the right advice, Now, talking about programs, mentioned like those where one can get free treatment. Is that what you're thinking? I've not heard of any. I've not seen of any. And if there is, I will gladly refer patients that are positive so they can get free treatment from that. And that's why one of the key messages of this year's World Hepatitis Day is to, tell lawmakers, policymakers to advocate for free treatment and all that. Mention something again?
Yeah, finally, where exactly can people go, when they're confused about where they can get help or screening or vaccines and all of that in the country?
So most hospitals, private or government hospitals, have facility for testing and also for treatment. Now, if you are not getting the right information, you can actually look for where you can get a gastroenterologist and a hepatologist. And most states in Nigeria have those specialists.
Okay. Well, primary healthcare centers included or?
No, primary healthcare centers, you can't find a specialist there. Usually tertiary or maybe secondary healthcare facilities.
Can you give us just one example so people can then use that to?
So our center, University of Abuja Teaching Hospital.
Okay, so basically teaching hospitals.
Yes.
All right.
But I don't want to say teaching hospital alone, you understand?
Yeah.
Some secondary healthcare facilities can actually offer this kind of care.
So what's an example of that as well?
Well, like Garki Hospital in Abuja can actually do that.
All right.
Okay. All right. We have a 2030 agenda. So the rate or what's the state of where we are right now and what's the possibility of achieving the 2030 agenda of at least helping people who, spreading the gospel of the hepatitis and also helping people who are positive in the disease?
I would say, this discussion is actually part of, I think so should also get towards achieving that 2030 goal.
Okay.
You know, I would say probably we are far from reaching that goal, but all hands are on deck to ensure we meet that goal. You know, it's possible to actually eliminate hepatitis. You know, I'll call on, you know, or even social media influencers, which is, it's a means where you can actually reach a large population these days. You know, I'll call on all social media influencers to also raise awareness about hepatitis. You know, but it's doable. We can actually eliminate hepatitis by that 2030, hopefully.
Indeed, and I believe also in part of the commemoration of this day, the minister, Mr. Pate, spoke about collaborating with WHO to reduce the burden, and and I think when I asked before if there are any programs, so what I'm realizing is that the programs are geared more towards prevention and early detection, because from what you said also, it makes it easier, much more a simpler process than what we get. So can we talk now about when it has happened? You've screened and you found that you have it. What happens to those people's lives, And this is just a point of understanding or giving hope, if there is, so that people know that it even helps with the screening aspect. Because if you know that if I screen and it's positive, I'm not dying immediately, or there are things I can do, it will help. So what happens in the treatment phase and all of that, and what are the typical rates of survival and all of that?
So this still takes us back to awareness. When people are aware that just being tested doesn't mean I am dying, that eventually, even if eventually you're positive, there's treatment for that. One. Now, we select our patient for hepatitis B, we select them, we look at certain things, or let's say criteria, so we can start treatment. There are different guidelines we follow, so we can start treatment. Hepatitis C is actually curable. We actually do some tests just to confirm if the virus is actually there, because what we are testing is the antibody, like soldiers. So even if you've had a past infection, the test might still show positive. So we do like a confirmation for the hepatitis C. And once it's above certain limit of detection, we treat it, because, as I said, hepatitis C is treatable.
If it isn't, what happens? You don't treat it.
If it's what?
If it isn't above that level, you don't treat it.
Yes, it means one already had a past infection, and it's because the test for the hepatitis C actually picks up what we call antibody. So even past infection might actually show us positive. So we just do a confirmation for the hepatitis C. Now, there are people you will not actually pick in these early stages. Some you just pick them at a stage where the liver is small. And at that stage, liver isn't able to carry out its normal function. You understand? Some, you don't pick them up at that stage where the liver is small, meaning the liver has been damaged. You pick them up at the stage where they have liver cancer, which is more of what we are seeing. When we do statistics in a hospital, like the mortality we have maybe in a month, it accounts for most of our mortalities. Now, we pick them up at that stage. So when we do pick them up at late stage, we usually stage them. There is a staging system. So we determine what kind of treatment the patient can get. Very early stages liver transplant. And you said it, and it's true. We don't have transplant surgeons in Nigeria. We don't have facility for that. It means you're going to refer the patient outside this country. There are some we actually refer for what we call, for what we call like local regional therapy. It's a kind of treatment where you get the cancer cells, you use certain things to actually, will I say, burn them down. And then there's a stage where we use what we call chemotherapy. That's tablets, so we can reduce the blood supply to the cancer cells. And there's also a stage where we use what we call immunotherapy. That means you're using some modulators, things that can modulate the immune system such that it can fight those cancer cells. But of course, advanced stage, you just do what we call supportive care. Like you just put it, there isn't much you can do. So I'd like to state categorically that, each of these treatments requires money, So what happens to patients that cannot actually afford this kind of care? So that's actually another limiting factor. That's why we're calling on all policymakers also to advocate for free treatment for those that have the disease and also complications.
Indeed, we should also not fail to know that Nigeria actually has the third highest burden globally for hepatitis, and the minister says that they're definitely working on it. So let's hope that we see some changes. But you've also suggested, John, you have any more to add?
Well, no, not really.
All right. Okay, so maybe I should sneak in just one final question. Are there any other suggestions you might have, perhaps to the government, that could ease this process? Perhaps, for instance, all of what you did at the event, did that require special funding? Did you do that on your own? What goes into that, and how can we have more of that across the country?
Okay, so for the free testing we did and the counseling, we collaborated with some pharmaceutical companies like Mega, also Healthline Pharmaceuticals, Guest Pharmaceuticals, and also Micronova under Philip Pharmaceuticals. So that's where we collaborated with them. Okay, so we didn't get anything from the government actually, and we're hoping that next year maybe we can actually get something from the government.
Indeed.
Okay, I think I have a question now. You said next year. So does it mean it's not really consistent or is done yearly?
Okay, so he mentioned the World Hepatitis Day.
Okay.
It's usually observed on the 28th of July every year.
Okay.
It's a one-time thing, the World Hepatitis Day, even though it's a specific day, but we expect, policies and decision and then all that to run all through. You understand? So he made reference to the World Hepatitis Day if there was any government collaboration.
Okay.
And that was why I mentioned those that collaborated with us for this year's World Hepatitis.
All right. Your answer actually, I got a better answer than I expected, which is to say that even private individuals and institutions can play their role, even while we're waiting for government to do its part. We can always be a part of it. I mean,
I said even social media influencers can help us disseminate this message about hepatitis. You are also doing your own part by organizing this program. I am also doing my part.
Thank you.
And then sometimes even on my social media handle, I pick up specific topics and then I talk about it just to create awareness.
Indeed. Thank you so much.
Thank you.
Thank you for mentioning our own parts in this. We don't want to toot our own on. It's good to have you here. So that's how we round off this segment of the program. We'll go on a quick break and we'll take our Verified Voices segment just to get a sneak peek of what the voices are saying on this particular issue. Don't go anywhere. We'll be right back.
Every day,
Amazing stories of hope and tenacity unfold across the globe. On Hude Hour, we dive into these inspiring tales and discuss the vital work being done in the humanitarian and development space. Humanity has never faced a shortage of challenges, yet we rise stronger through teamwork and determination. Though these remedies are often underreported, on Hude Hour, we advocate sustainable solutions. We bring you the latest and most impactful news on how lives are being changed. We engage with young change makers and experts who provide valuable insights into relief efforts and the challenges faced by local communities through a global perspective. Join us every Wednesday by 8 a.m. on Hude Network's YouTube channel as we embark on this journey of positive change.
Culture connects us beyond borders. It's a bridge between traditions, creativity, and the future.
Culture is alive, shaping identities and communities every day.
Art tells stories of resilience and vision.
Artists blend tradition with innovation.
Cultural preservation creates sustainability and empowerment.
Culture evolves and adapts.
Music and dance unites communities through movement.
And right here, in the heart of our cities, artists and creators are keeping these cultures alive.
On Culture Cove, let's explore,
Celebrate and preserve the arts and culture that define us.
Welcome back. It's time for our verified voices. We've been joined by Omokafe Dennis. Hello, Omokafe. What do you have for us?
Hi. Of course, still in line with the World Hepatitis Day. We've got all the verified voices from Hepatitis Day. So we'll be joined with some verified voices from a lot of verified people on X, of course. Yeah, so we have one from the WHO, that is the World Health Organization, saying #hepatitis B can be prevented with a safe and effective vaccine. The vaccine is usually given soon after birth with boosters a few weeks later and offers nearly 100% protection against the virus. And as you can see, there's a picture there saying only 45% of babies received the hepatitis B vaccine within 24 hours of birth in 2022. A timely dose at birth can prevent babies from developing liver cancer later in their lives. So in a nutshell, this particular verified voice is saying whenever you give birth to a baby in the next 24 hours, kindly vaccinate the baby with hepatitis B vaccination.
Indeed, and the numbers are only 45%.
45%.
It's a bit concerning, but I think also for people who get booster doses, it's important that you complete it. That was one of the counseling I received yesterday, so I think people should know that as well. So what is your first?
Yes, okay, so we have the next one from Dr. Kelechi Okoro, of course, rightly saying I am an Mboing babe. So this is a Nigerian saying, bad news, every day 3,500 lives are lost to hepatitis B and C, yet most people do not even know they are infected. Good news, hepatitis B is treatable, hepatitis C is curable, prevention is possible, get vaccinated, practice safe habits, test early, of course. So,
well, thank you so much, Omoka. And that's all we can take for now on our huge special for today. See you next time. Bye for now. I am Amadou Nubewe.
And I am Joan Eze. Thank you so much. Stay safe.
you.